instructional video for the Tissu-Trans Filtron systems. Prep patient in standard sterile technique. Infuse harvest site with standard tumescent technique. Place a sterile drape over the tall canister stand. Attach the Filtron unit to stand by the universal bracket. Connect standard sterile suction tubing to the Filtron lid at vac, which is the vacuum port. Connect the other end of the tubing to a standard waste canister and suction source setup. Medical grade harvest tubing comes attached to Filtron lid. Connect the loose end of this tubing to your liposuction handle. Turn on the aspirator and adjust suction to approximately 15 inches mercury, which is a half atmosphere or 50% of power. Begin harvest. A 3 millimeter cannula diameter is recommended for best harvest. As fat flows into the Filtron unit, the waste is filtered and suctioned out into the waste canister. Quality fat remains in the Filtron and is ready for re-injection. When the desired amount of fat has been harvested, turn off the suction. Next, disconnect the tubing from the Filtron lid and close the port with the attached caps. There are two options for removing fat from the Filtron unit. With the first option, the system remains upright. Simply remove the cap from the large Cap 1 port. Attach the transfer straw cannula to the re-injection syringe. You can also use your re-injection cannula for this step. Insert the cannula into the unit. Draw back the plunger and fill the syringe with fat. Fat is now ready for re-injection to the recipient site. Repeat with additional syringes as needed. With the second fat removal option, the system is inverted. Attach the transfer tube, which comes with the Filtron, to the patient port on the lid. Be certain that the white pinch clamp is closed. All other ports are capped and sealed. Invert the entire unit and reattach to the stand using the same universal bracket. Attach a re-injection syringe to the luer lock tip of the transfer tube. Open the white pinch clamp on the transfer tube. Draw back the syringe plunger and fill the syringe with fat. Remove the syringe from the transfer tube and attach the re-injection cannula. Fat is now ready for re-injection to the recipient site. Repeat with additional syringes as needed. When the procedure is complete, discard the entire unit.